Hi, everyone. My name is Michael Gusmano. I'm a professor in the College of Health at Lehigh University and our Associate Dean for Academic Programs. I thought I'd spend a little bit of time telling you about my research and teaching interests so you can get to know me a bit and decide whether you'd like to join us at the College of Health. I'm a political scientist by training with expertise in health policy and long-term care policy. My research and a lot of my teaching really falls into two buckets. First, I'm interested in the extent to which people are able to influence the policies that shape their lives. So I'm interested in democratic participation, and I'm especially interested in whether poor and vulnerable groups are able to have a voice in the policy process. The other thing that I do is I look at the consequences of existing policy, particularly for poor and vulnerable groups, because I'm really concerned about inequality within the US and across the world. As part of this, I've done a number of research projects that have looked at the politics of health reform. So in addition to looking at debates around national health insurance and around the creation, for example, of the Patient Protection and Affordable Care Act, known as the ACA, I have looked at the implementation of that law over the years of its existence. So for the first decade, there have been a lot of negotiations, for example, between the federal government and state governments, as well as the involvement of courts in shaping that law. And so through a series of book chapters and articles, I've explored the politics of the ACA and its implementation with colleagues around the world. Beyond looking at the politics of health reform, I'm really quite interested in whether or not policies like the ACA actually make a difference and influence the health and well-being of populations. So to do that, I've really been engaged in something that is often known as health services research, using different types of data to understand the performance of health systems and sometimes to investigate whether or not policies are working as intended. Part of this involves my project called the World Cities Project. For 20 years, colleagues and I have looked at large cities around the world. We started with the first four largest cities in the rich countries of the world: New York, London, Paris, and Tokyo. In more recent years, we've branched out to look at large cities in some of the so-called middle-income countries of the world, places like Shanghai, São Paulo in Brazil, New Delhi in India, and Moscow in Russia. These cities are interesting for a bunch of different reasons. One reason they're interesting is that more and more people live in cities. The world is becoming increasingly urbanized, and it's important and interesting to better understand how people's lives are shaped by the built-in and social environments of cities, and in particular of the neighborhoods in which they spend their lives. The other reason it's interesting for me as a policy scholar to look at these cities is they provide a really interesting window into the consequences of national policy. If I think about my four original cities, New York, London, Paris, and Tokyo exist within countries that have national health insurance systems. London, in contrast, exists within a country that has a national health service, where the government plays a more direct role in actually hiring physicians and running hospitals. In New York, it exists within the US, which has a strange and unique mix of a public-private system with big gaps. Even after the ACA, there are millions of Americans who do not have health insurance or who have very limited health insurance. And so by looking at these cities and comparing them, both health across and within the cities, it gives us a window to better understanding the consequences of these different healthcare systems. Along with the work that I've done comparing health systems around the world, I'm also deeply involved in a field known as bioethics. Bioethics concerns itself not only with health equity, but about the value implications, the normative implications of emerging technologies. For several years now, I've run projects that have looked at the implications of new gene editing tools that allow us to reshape organisms and plants and even human beings. One project that is just finishing up was funded by the National Science Foundation, and that involved looking at how we should regulate gene editing in the wild. There are efforts ongoing to change plants and even change some organisms to modify them in ways that benefit human beings. For example, there are several efforts right now to modify the genomes of mosquitoes to reduce the probability that they can transmit diseases like malaria. Now, these hold great promise to save thousands, if not millions of lives, but they also raise really important questions about how we ought to govern the shared environment. One of the suggestions for how to do so involves bringing people together for broad public deliberation. My project brought together people who are experts in broad public deliberation with people who are experts in gene editing to think about what are the special considerations that we need to have in mind if we, in fact, we try to do this suggestion and organize broad public deliberation. And if we do that and people have really informed, interesting conversations with each other about these technologies, how should policymakers use that information to regulate things at the national and international level? My most recent project, which is funded by the National Institutes of Health, involves something that's been in the news quite a bit lately called xenotransplantation. Xenotransplantation involves taking organs, in this case, that have been grown in pigs or other animals and transferring them into human beings. My project is looking at the potential for experimentation with kidneys that are grown in pigs. These again raise lots of interesting ethical questions, and it's likely that within the next several years, we're going to have several human clinical trials investigating this. Who should participate in those trials? How should they be governed? How should we think about the risks and the benefits involved in trying to develop pig organs? How do we respond, for example, to animal rights activists who may object to the use of organs grown in pigs for fear that it will lead to slaughter of pigs in order to benefit human beings? These are really interesting questions, and we'll be pursuing them over the next 4 years. As you would imagine, all of these interests of mine, the politics of health reform, understanding how health systems actually function, and thinking about how we govern emerging technologies are things that I cover in the classroom. So I've taught our intro to community health class. This coming semester, I'll be teaching a cross-national comparative health care systems class. And next year, I'll be developing a brand new class in bioethics, in which I get to explore some of the topics I just talked to you about. Anyway, I hope that allows you to get to know me a little bit more and get you excited about the College of Health. I hope you're able to join us here.